Your heart is a powerful muscle, working tirelessly to pump blood throughout your body. This vital organ communicates through electrical signals, and an electrocardiogram or ECG is like a microphone, capturing these silent conversations. Imagine your heart sending out tiny electrical impulses with each beat. An ECG records these impulses as waves, creating a visual representation of your heart's rhythm. Think of it like a heartbeat detective. By analyzing the patterns of these waves, doctors can gather invaluable information about your heart's health. ECGs are essential tools for diagnosing a range of heart conditions, from irregular heartbeats to heart attacks. ECGs are like windows into your heart's electrical activity. They provide doctors with critical insights into how your heart is functioning, allowing for early detection and treatment of potential problems. This simple yet powerful test plays a crucial role in maintaining your heart health. Just like conversations have different styles, there are different types of ECG tests, each tailored to capture specific information about your heart's activity. Let's explore the most common types. Resting ECG. Think of this as the baseline conversation. You lie comfortably while electrodes attached to your chest, arms, and legs record your heart's rhythm at rest. It's a quick and painless snapshot of your heart's electrical activity. Ambulatory ECG. This is like recording a conversation throughout the day. You wear a portable ECG device that continuously monitors your heart's rhythm as you go about your daily routine. This is particularly useful for detecting irregular heartbeats that might be missed during a resting ECG. Exercise stress test. Imagine your heart having a slightly more intense conversation during exercise. This test involves walking on a treadmill or pedaling a stationary bike while your heart's rhythm is closely monitored. It helps evaluate how your heart responds to physical exertion, revealing potential issues that might not be apparent at rest. Each type of ECG offers a unique perspective on your heart's electrical activity. Your doctor will determine the most appropriate test based on your individual health needs and medical history. Having an ECG is a straightforward and painless procedure. Let's walk through what you can expect. Preparation is key. You might be asked to avoid applying lotions or oils to your chest on the day of the test, as these can interfere with the electrode's ability to pick up your heart's signals. Getting comfortable. For a resting ECG, you'll lie down comfortably on an examination table. Small, sticky electrodes will be placed on your chest, arms, and legs. These electrodes are painless and simply act as sensors to detect your heart's electrical activity. Relax and breathe. Once the electrodes are in place, you'll be asked to lie still and breathe normally. The test itself only takes a few minutes. Quick and easy. The ECG machine will record your heart's electrical activity, creating a visual representation of your heartbeat. Your doctor will then analyze these recordings to assess your heart health. ECGs are non-invasive and painless. The entire process is quick and easy, often taking less time than a regular doctor's appointment. Remember those waves we talked about, the ones that represent your heart's electrical impulses? These waves form a distinct pattern known as the PQRST complex. Each segment of this complex, the P wave, QRS complex, and T wave, corresponds to a specific electrical event within your heart. The P wave is this small bump that represents the electrical activity causing your heart's upper chambers, or atria, to contract and push blood into the lower chambers, or ventricles. Next, we have the QRS complex. This spiky section reflects the electrical activity associated with the contraction of your heart's lower chambers, pushing blood out to the rest of your body. Finally, there's the T wave. This wave represents the electrical activity as your ventricles relax and prepare for the next heartbeat. By analyzing the size, shape, and duration of each wave, and the intervals between them, doctors can gain valuable insights into your heart's rhythm and overall function. Analyzing an ECG involves carefully examining the PQRST complex for any irregularities. Here's a simplified breakdown. First, the heart rate. The distance between two consecutive R waves reveals the time between heartbeats, determining your heart rate. Next, rhythm regularity. Consistent spacing between P waves and QRS complexes indicates a regular heart rhythm. Irregularities might suggest an arrhythmia. Then, P wave assessment. The size and shape of the P wave offer clues about the electrical activity in your atria. For the QRS complex examination, the width and height of the QRS complex provide information about the electrical activity in your ventricles. Lastly, T wave evaluation. The shape and size of the T wave can reveal potential abnormalities in ventricular repolarization. While this provides a basic overview, remember that ECG interpretation requires specialized knowledge and training. Always rely on your doctor's expertise for accurate analysis and diagnosis. ECGs are invaluable tools for diagnosing a wide range of heart conditions. They can detect arrhythmias, like irregular heartbeats, such as atrial fibrillation or ventricular tachycardia. They can also identify heart attacks, which is damage to the heart muscle due to blocked blood flow. Additionally, ECGs can detect heart block, which are disruptions in the electrical signals that control your heartbeat. Pericarditis, the inflammation of the sac surrounding the heart, can also be detected. Finally, they can reveal electrolyte imbalances, which are abnormalities in the levels of potassium, calcium, or magnesium in your blood that can affect your heart rhythm. Early detection of these conditions through ECG testing allows for timely intervention and management, improving treatment outcomes and potentially saving lives. ECGs are safe, painless, and non-invasive procedures. They involve no needles, injections, or exposure to radiation. The minor risks associated with ECGs are extremely rare and typically involve skin irritation from the electrodes. These tests play a vital role in maintaining your heart health. They provide your doctor with a clear picture of your heart's electrical activity, enabling them to diagnose and manage potential problems effectively. Remember, your heart health is paramount. Regular checkups, including ECGs when recommended by your doctor, are essential for early detection, timely intervention, and a healthy heart for years to come.